Good morning. This is the day the Lord has made. We will rejoice and be glad in it. This is Edith Anderson of Let's Talk Radio Broadcast. And I want to say good morning to you. And once again, we're so glad to be back on the air. And also we'll be going Facebook live streaming on Facebook as well. And I greet you in the matchless name of our Lord and Savior, Jesus the Christ. And I just want to say that I do honor the Holy Spirit, who is the head of my life. A shout out to my pastor and first lady, in their absence, Reverend Dr. C.L. Anderson, Lady Helen Anderson, and to the Mary Grove Missionary Baptist Church of Guard, Georgia. Once again, we are back on the air, and it's definitely a blessing. And on this morning, I am definitely excited because we have a panel of special guests, and they're going to share. And the title of this broadcast on this morning is, Are You Vaccinated? Are you vaccinated? We're just simply asking the question on this morning because we realize that COVID-19 is raging all over the land, not in one particular area of the country or the world, but is raging all over the land. And so we come to ask the question on this morning, are you vaccinated? And today we're pre-recording. The event has been pre-recorded, and today is August the 4th. And as of August the 4th, over 613,000 souls have lost their lives to COVID-19. And we want to inform you and to give you some information on today. So we're going to start out with our panel of guests. I'm going to call their names, and as I call their names, they're going to introduce themselves. We have Shaka Fennell from Diversity Health Clinic in Hinesville. We have Keir, who is a COVID survivor. We have Minister Marcel McManus, and he's going to introduce himself. We have Russaw White. We have Jerrica Russaw. We also have Jaden Scott, and we have Taylor Elston. So at this time, I'm going to ask Shana to briefly give us some information about herself, and we would follow with Shana, then we'll go with Keir, and we'll just go around the room.
Good afternoon. My name is Shaka Fennell. I am the Director of Operations for Diversity Health Center. I have been providing services in the public health field for the past 15 years. And I've been a part of this COVID pandemic since the beginning, as we were boots on the ground as community health centers in the area.
Thank you, Shana. And we just want to thank you for consenting to be on the program on this morning. Next, we'll go to Keir Walthauer.
Hey, good evening, everyone. My name is Keir Walthauer. I currently reside in Ellenwood, Georgia. I have an appliance repair business in Atlanta. And well, since COVID started, I was busy during COVID and active due to the fact that majority of people were at home. So it was really dangerous, and you learned a lot doing it. So I caught the COVID and survived. So I'm here to give you a bit of information on it.
Thank you, Keir. Minister Marcel McManus, you're next.
My name is Marcel McManus from Albany, Georgia. I own my video production company, McManus Productions, and radio personality and newly author of the book entitled God Trusted Me with the Mic, and I'm just glad to be here to share them today.
Thank you. Russaw White.
Hello, my name is Russaw White. I am in Auburn, Alabama. I'm a 15-year employee of East Alabama Medical Center, where I served as an LPN, recently graduated with my RN in December, and awaiting getting state certified for my RN. And I also have a virtual talk show entitled The Open Door Live, where we discuss current topics in gospel and ministry. So I'm excited to be here today.
Thank you, Rashad. Jerrica.
Hello, everyone. My name is Jerrica Russaw. I am originally from Hinesville, Georgia. I now live in Valley, Alabama, where I serve as the student recruitment coordinator for Auburn University's Poultry Science Department. I also am a graphic designer with my own company, Jerrica Designed It, as well as JP Designs Art. And I'm also a published author as well. Congratulations on recently becoming a published author. That is such a wonderful feat. Congratulations and welcome to the club. Of a book called Life Without Parole, The Journey to Freedom. And I am also a 2-time COVID survivor.
Yes.
All right, and you're going to share some additional information later on about that.
Yes, ma'am.
Thank you, Jerrica. Jaden?
Hello, everyone. My name is Jaden Scott. I am 19 years old, and I'm a sophomore at Augusta University, getting my degree in biology. I am a COVID survivor as well. Very blessed to be here with you all today.
Thank you, Jaden. Taylor?
Hello, my name is Taylor Elston. I am right now attending KIPP Suffolk Academy. I am heading to the 8th grade, and right now I reside in Atlanta, Georgia.
Thank you, Taylor. At this time, everybody has already introduced himself, and we're going to ask Shana Fennell, who works with Diversity Health Clinic, to give us some information about you told me last week that the cases were going up in Liberty, not only Liberty County, but all over the place. And I want you to give us some information about COVID and also what the Diversity Health Clinic can offer as it relates to COVID-19.
Yes, ma'am. So here recently, and like I explained to you last week, in the month of June, for example, we gave a total of 42 COVID tests. However, in the last 2 weeks, I've given 75 COVID tests. So what we're looking at for the month of July is that we'll give well over 250, about 250 tests for the month of July. What we realized in this uprise of testing is that we're getting a lot of positives. So where I didn't get any positives in the month of May, and I didn't have any positives in the month of June, not only am I getting positives now, on an average, we're getting about 5 to 7 positives a week. We got a rise in the number of tests we was giving. We kind of got bombarded with tests all of a sudden. For example, one day last week, a company shut down their whole company for the day. They sent all 15 of their employees to us for rapid testing. Then we realized when we talked to some of our colleagues around the state that it's happening to everybody. The cases are rising. It's really not in the media as much as it was last year this time. However, this Delta variant is taking kind of overtaking. It's coming rapid, it's coming quick. And what we're realizing as well, the trend is if you're not vaccinated, you have worse symptoms. It's not that if you're vaccinated, you cannot get the virus, because you can. But your symptoms are a lot less severe if you're vaccinated versus if you're not vaccinated. So at Diversity and around the state of Georgia, what we are encouraging people to do is please get vaccinated, because you can still be a carrier if you're vaccinated, and you can be spreading it amongst others. But most importantly, if you're vaccinated, you're less likely to get hospitalized, you're less likely to end up on a vent, you're less likely to see death as a result of this. So at Diversity, of course, we are offering the COVID vaccine, and there's 3 vaccines out in the community right now. There's the Moderna 2-dose, there's Pfizer 2-dose, and there's Johnson & Johnson, which is 1 dose. At Diversity, we offer the Moderna vaccine, which is a 2-dose process. You come in for the first dose, and you come, and we make an appointment for you to come back in 28 days to get your second dose. So if anybody's interested that's listening and needs the vaccine in the Liberty County, Long County, Wayne County area, please call us at 912-877-2227 to make an appointment to come in to get the vaccine. If you want to get tested, you call that same number and we'll get you tested as well. Please be mindful that in the state of Georgia, that the numbers are rising. From June to July, we at a 5-time higher rate of those people testing positive for COVID-19.
Thank you, Shauna, for sharing that information with us. And you said that you can get the rapid test.
Yes.
Now, when you get the rapid test, when do you get your results?
Okay, so we do both the rapid test, 2 tests. The rapid one is the rapid test, and that test takes, it takes 10 minutes. You sit in the parking lot, and then we'll come back out in 10 minutes to tell you what your test results are. Or we have the other one, which is called a PCR. I hope I got that right, PCR test. And that's taking about, it could take anywhere from 24 to 72 hours right now for those test results to come back. That number may get a little longer, the days, according to how much testing happens in the local communities and how many tests LabCo have to turn around. But ideally, the rapid test takes 10 minutes. Those are available. We have those available right now on the cart. And let me put this disclaimer out. For the rapid test, is a fee associated with the rapid test is $75. However, the PCR test, you can come in, and if you don't have any insurance, you can get that test for free.
Thank you.
You're quite welcome.
And we want you to hear what she has said, that you can get the rapid test and it's $75, but for the regular one, if you do not have insurance, that it is free. And you also said that most of the people who are coming in to get the test now, that the results are coming back positive. Did you say that?
So we're having a higher number of positive results right now. Not most people, because I don't want to get that false conception. It's not most people, but we're having an alarming number of positives versus what we had last month in the month of June.
Okay, and according to what I've been hearing, that the Delta variant is so much more deadly than the regular COVID-19.
Yes, ma'am. It's a lot more contagious. So encouraging people to wash their hands a lot, make sure they keep their hands sanitized, they keep them out of their face. It's kind of what the trend of the CDC is, because it is so contagious and you catch it so easily.
And someone who has been vaccinated, they can also get it and spread it.
Yes, ma'am. Please be, to all those that are vaccinated, please still wear your mask and be careful, wash your hands, everything we was doing last year this time, because yes, you can, even if you're vaccinated, test positive for COVID-19. For example, my daughter got vaccinated back in January, fully vaccinated in January through her school because she's in the medical program. But 2 weeks ago, 3 weeks, about 2.5, 3 weeks ago, she tested positive. She went in for the rapid test. She was like, maybe I really don't believe it. Maybe it's something else going with me. So I'm gonna go for the other test. And they both came back positive. So of course she had to go through the whole quarantine, stay safe to keep her and her roommates safe. But yes, if you are fully vaccinated, you still can become positive. The plus side to being vaccinated is that you're less likely to have severe symptoms. For everybody's symptoms are different. But my daughter, for example, she's like, I was very tired. The only thing I want to do is sleep. And I had a little bit of muscle aches in the first 1 or 2 days, but I don't know if that's because I walked a lot that weekend before or if it was a side effect from the coronavirus.
Okay, thank you. So what you're hearing is that even if you're vaccinated, you're still not immune from getting COVID. And not only that, you can still also transmit it or pass it to others. Thank you. Now we're going to go to Keir. Keir had COVID last year, and I just want for him to share some of the things that he went through.
So hello everyone. I caught COVID last year, the 3rd of July, right before the 4th of July. And I sort of thought that I have allergies, so I thought it was just an allergy infection. So that Friday when I went to bed, I just went to bed and I started feeling pretty bad in my sleep. And I woke up and I had a slight fever. So I just sort of went back to sleep and I actually slept the entire weekend from Friday to Monday morning. And then I went to the doctor. I was weak. I didn't have any strength or anything. So I went to the doctor, they gave me the test and I had COVID. And it's a feeling that I wouldn't wish on anyone personally. I'm usually the health nut. I stay kind of healthy, eat healthy. But it really, really took a toll on me. Strength wise, I didn't have it. My fever actually got up to 103. The doctor put me in quarantine for 14 days. After the 14 days, or during the 14 days, they called to check up on me. Strength was still kind of weak. As far as symptoms, I caught the fever. I didn't lose my sense of smell. I had all my senses except for the fever. But as far as weakness, it took me about actually 2 months to actually gain my strength back. Breathing was mediocre, but gaining the strength back from it was just, I've never experienced anything like that before. I was so weak to the point where I just felt like a child could just push me over. And what I've learned from it, most of all, is not to take it for granted. Wear your mask, wear your gloves. At first, I was just kind of light with it. And I see a lot of clients today because I'm in that type of business. And I hear a lot of conversations about, them not wearing masks or vaccinated. But overall, you have to take precaution and use common sense most of all. Hey, the coughing and stuff like that, you have to go on your own opinion, but know that COVID is really, really out there. If somebody says they have the shot, still wear your mask. Ask them to wear their mask. And, be cautious of what's going on around you. The large gatherings, they're not good at all, just to be honest with you. And what I've learned also, you have people that have taken the vaccination, and you have those out there who are simply lying and say they took the vaccination and haven't. So the best thing to do is just actually be cautious about it. And of course, asking a person did they take the shot, that is kind of personal, but some will answer and some won't. And most of all, stay prayed up, because that's what I did. I mean, once I found out I got it, I just left it in the hands of God, and I said, okay, I can't handle this. Only He can handle this. I left it there, and with strength prayer and calling for my mom and family members, hey, I'm here. So to all that don't have it, get it. And those that don't want to get it, think about it. Or if you don't want to get it, put a mask on, put some gloves on, hand sanitizer, and keep going. So, for with that being said, be safe.
Thank you, Keir, for sharing your testimony. And now we're going to go to Rashad and Jerrica, because I found out that they had COVID at the same time. And I want you to share how you got COVID. And Jerrica says she's had it not once, but she's had it twice. So we're going to ask Rashad, you go first, and then Jerrica.
Okay, excellent. Well, my COVID experience actually happened at the very beginning of the pandemic. So I wasn't one of the ones that was able to say, well, I knew this person that had it before, or, I've seen people are recovering from it. I got married on March 13th. And the shutdown happened on March 15th. So that Friday, got married. That Monday, the nation went crazy. And after we came back from our honeymoon, I think that Wednesday, that's when I actually found out that Jerrica was actually getting tested. And at the time, we were like, okay, well, maybe it could be, maybe it couldn't. Came to find out that she had a positive result. Me working in healthcare in the hospital, they automatically took me out of the whole hospital. Like, they were like, we're gonna wait and see what's going on. I stayed out of work for a month after getting tested that next week and finding out that I had COVID, just because they weren't sure if it was safe for me to go back into the environment. And I'm gonna let Jerrica tell about her experience, but I know for myself, in that course of the month, when I started getting symptoms, I lost my sense of taste. I had a little bit of a wheeze, but I was taking vitamin C, I was taking zinc, I was taking plenty of fluids, and it felt like I had a sinus infection, and I had muscle aching and sinus drainage. Other than that, I didn't have a lot of major respiratory issues, and I kind of coasted from there. I think just because I ramped up on having all those vitamins in my system. But I also, after I went back to work, worked on a COVID unit. And that was a whole nother experience. But before I dive into that, I want to make sure that I give Jerrica the space to give her actual experience for herself. So Jerrica, you want me to go ahead? Okay, so after getting back into the workforce and, I was able to have my own COVID experience, people kind of watch and see how I took it, actually going in and seeing, because I worked in a nursing home setting, seeing the elderly deal with COVID compared to myself was a whole nother ballpark. So for the people that go around and saying, well, I'm fine and I'll bounce back, please be mindful that you're spreading it to somebody that may be a caregiver to someone that's older. You may see healthy people that are carrying, but it literally, and I just got to be real when I say it was traumatizing to see one person get taken care of one day and then you come back and they're gone. And then their roommate have COVID and they start showing symptoms. And then the next week they're gone. I stayed up there for, I think, a total of maybe about a month. And it literally and a lot of this wasn't publicized because, you don't want to scare your general population. However, COVID is not anything to play with. And I, for myself, working in the healthcare industry and talking to other nurses, feel like we've almost gone through like a war. Like we literally are traumatized after seeing the burnout and seeing the effects on the population. So I say get vaccinated, get vaccinated, get vaccinated. Don't be afraid of the hearsay. Go by the facts and do what's best for yourself. I really want to see everybody happy, healthy, and whole. So that's my experience.
Thank you, Rashad. Jerrica?
Sure. So the first time I had COVID, like Rashad said, I was in their wedding. And I was there, and at the time we were all staying together because his wife is one of my best friends, and her and I were living together, and we only had a few months left on the lease, so we all kind of just bunked it out together. And like he said, I tested positive first. I remember I wasn't showing any symptoms. I already have a cough because I have asthma, so I have a cough naturally anyway. But I noticed that my coughs kind of ramped up a little bit. And I kept having some kind of issues here. And then one day I was sitting at home watching TV, and then like literally out of nowhere, I just felt really bad. And I said, well, y'all, I think I'm gonna go get a COVID test. And so I went to urgent care. They tested me for the flu and everything else and said, well, it's not that. You might need to go to the hospital. And then that is where I tested COVID positive. And I'm going to be honest with you, I am a woman of faith, but when they told me I had COVID-19, y'all, I broke down like a child. Simply because it was in the beginning. We did not have a lot of information about COVID. The only thing that I knew was when people had COVID, they did not make it. And so, I prayed and talked to God. And I was like, Lord, I know you did not bring me this far. I know you did not bring me out of all the other medical issues I have just to get me here and then to let me perish. And one of the things that kind of really got me this far into really, I would say being healed, because I'm the textbook person. If you look at my medical chart, I'm the textbook person that COVID should have really, took me out of here, honestly. But I have a shirt that says faith saved me, and it came out of me having COVID-19. I believe in me really just praying, me drinking my fluids, me doing what I'm supposed to do. Faith without works is dead. So me having the faith, but me also doing the works is something that I really think brought me out. So the first time I lost my sense of taste and smell, I felt like I had a really bad sinus infection. I dealt with like the drainage. I dealt with just feeling really bad over time. Like sometimes I dealt with not really having an appetite, being weak. I dealt with all of that good stuff. But I think with all of us kind of being together and us kind of having COVID together, it really helped because we all kind of kept each other encouraged, which I think is something that's very important, because just like with any other sickness, your mind is very powerful. And if you allow your mind to succumb to what it is that you're going through, then you will succumb to it. But if you have a mind that sees further, that says, you know what, I am more than a conqueror. God is not going to leave me. He's going to walk through the valley of the shadow of death with me. I don't have to worry. Then you will become the victor of your circumstance. And I truly believe that it was a mindset thing for me. The second go round was definitely not nearly as bad as the first. I was just as surprised as everybody else. That lady called me. I said, girl, let me give you my social, birthday, everything else to make sure. Because surely I couldn't have gotten it the second time. But I did not lose my sense of taste and smell. I just lost my energy that second time. And hopefully we're not going to shoot for a third. Hopefully we are delivered. We are vaccinated. Hopefully we do not have to worry about that anymore. We're doing the things that we're supposed to be doing. So if I could give any advice of anybody that's kind of on the ropes about getting the vaccine, I know that you've heard a lot of things about, oh, I don't know if they've done enough research and we just taking these shots and doing what we have. Well, listen, I'm going to do everything that I know to do to prevent myself from going through what I went through again. Okay. And if that means I'm going to get this vaccine, then that's exactly what I'm going to do. I work for higher education and I interact with too many people just to be out here winging it. Okay. The Lord gave me common sense for a reason. So I went up there and let them folk poke on my arm so that I can be protected the next time. So I do encourage that you all do the same. You cannot listen to what everybody is saying because there are a lot of non-doctors out here giving medical advice. You need to talk to your medical professional and do what's best for you.
Thank you, Jerrica. Now I'm going to go back quickly to Shauna with the vaccine. Can you give some information on some of the side effects? Because so many people they're afraid. They're really afraid. They've heard a lot of information about what can happen, that it can cause infertility, that it's a mark of the beast. Some of the things that you've heard is just misinformation. So can you give some information about some of the possible side effects from having the shot, the vaccination?
So the some of the side effects, first, let's say like the vaccine is very new. So the long-term effects of it, it just hadn't been around long enough for any of us to definitively say what's going to happen. So right now, a lot of the things that you're hearing about at this point are really myths, not facts. Again, because we just don't, it's just hadn't been long enough. And as Jerrica said, some people are scared about it because they hear all these things. You hear all these non-medical people talking about conspiracies and chips. And ideally, you should sit down and do the research for yourself. Because when you sit down and do the research for yourself and you look at the medical findings that are out there now, and you really realize how long this vaccination has been in the background, they've been working on it. So it's not that it happened overnight or all of a sudden. It had been being worked on for a while in the background, but the virus just came out of nowhere and started spreading so rampantly. I often like to tell people that it was like, what made you decide to get this vaccine? What made me get the vaccine is I felt like it was Russian roulette. I'm gonna roll the dice one way or the other. What's gonna happen? I don't know what how you feel about the long-term effects. Well, it hadn't been administered in long enough for us to really know. But long-term effects take years to happen. So by that time, normally years, and I say it's gonna take 30, 40 years if it's gonna be some type of long-term effects. By that time, I'll be closer to death per se than I am now. So when I'm rolling my dice, right now I want to roll the dice and stay on the side of life. So me getting vaccinated, that's how I look at it. Me getting vaccinated put me closer on the side of life than it put me on the side of death. So that's why it's important for me to get vaccinated, to protect not only myself, but to protect my kids, my family members, the elderly, my elderly relatives. We just don't want to spread it to them because we just don't know how will affect them. So I just always encourage people, please get vaccinated. If not for you, even if you don't want to do it for yourself, Do it for your grandmother, whom house you go to for Sunday dinner. Do it for the mother of the church when we go back to the church. If you don't care about it for yourself, just do it for somebody else. That means a lot more to you.
Thank you. Now we're going to Jaden. When I called you, I didn't realize that you had contracted COVID. I called you because you are the first recipient of the Reverend Walter Scott Scholarship that we give at Marygrove. And as I was talking with you, you shared that you had COVID. So just share a little bit about your experience.
Yes, ma'am. So at the beginning of the pandemic, I was a senior in high school. So when all this had came about, you know, I was getting ready to graduate. It happened like a month before graduation. So me to be completely transparent, I was very concerned, you know, with that. Once this thing got good and going and I saw how it was affecting everyone, and my grandmother, she had just been put in the nursing home at the time. So I wasn't able to see her as much as I wanted to. It made me, you know, want to take the necessary precautions to keep myself and others safe. So fast forward to the beginning of this year, I had got COVID in January. I had been, you know, being very cautious. I really didn't go out as much, you know, around that time. I would just go to work and come home. So whenever, you know, I started feeling sick, I was in public, actually. I was at the mall and I was walking, and I had been there quite all day, but I started feeling really tired, like really nauseous, out of breath. I never felt like that before. It felt like I had just ran a marathon. So we were supposed to stay, but I went home early because I didn't feel good. And like as the night progressed, I had like a 103 fever, or like real late at night. So I went to urgent care the next day and got a rapid test. And I came back that I had COVID. So I had more of the harsher side effects. Like my breathing was very compromised. I was in a lot of pain. Like I couldn't even really get up and go to the bathroom without, you know, being in like physical pain and just, you know, not really being able to bear it. I just slept the whole time. So my mom, being a healthcare worker, she caught it around the same time as me, which was kind of a shock because like I said, we were very cautious in the household about getting it. So she made sure I took lots of vitamins, and just I had to take like a steroid for my breathing, for my lungs to, you know, help me. And I got better. So around like March, it took a little longer than 2 weeks for me to get over the symptoms completely. And even after that, I still was very exhausted all the time. Even when I had got back up and running and going to school and stuff, by the end of the day, I would be exhausted. And it took a while for me to get back to being a full-time worker at my job because I was still kind of recovering from symptoms. So when the vaccination came around, it was almost like no question for me, because I thought about my grandma and my mom who works at a nursing home. And I was like, if I'm not doing this for myself, you know, I'm definitely doing it for others. Because my experience with the symptoms, I was like, I just don't wish that on anyone else. So I try to do as much as I can to make sure, you know, I'm doing the right things by preventing, you know, others to get it or experience what I experienced.
Thank you, Jaden. And our next two guests, they have not had COVID, but I want Marcel to share how he took the shot. He was part of an interview, and part of that interview encouraged him to take the shot. So go ahead and share how you came about taking the shot, the vaccination.
Yes, I was very skeptical when everything came out about taking the vaccine. My mom wound up contracting the virus and got really, really sick. And as time came along, when they came out with the vaccine, she kept encouraging me to take it. I didn't want to take it. I said, Mama, God got me covered. I ain't worried about it. You know, and it just kept being repetitive. You know, I kept hearing it over and over. And then Dr. Anderson invited me to come on a Zoom with Dr. Wingate, Pastor Wingate. And that interview, hearing her story and the things that she went through, it really made me start thinking and say, Marcel, you need to be wise. Yes, you have faith in God, but you need to be wise. That interview really made me look at a different perspective. Not being selfish, being open-minded, and realizing that this is serious. And take the opportunity to take this vaccine, which will be a better help than just going out here loosely. So Dr. Anderson, I want to publicly thank you for invited me to be on that interview that day. And I thank God that before then had nothing happened to me. And since then, my whole family, entire family and my household have not had it. So I encourage everyone who's listening and watching, definitely consider taking the vaccine so you can protect yourself as well as others that are around you.
Thank you. And we have one other person, Taylor. Taylor is 13 and Taylor had the vaccine. So Taylor, just share with us when you had the vaccine, what month you had it and some of the possible side effects and how you feel as a young 13-year-old.
Okay, I took the vaccine in May because of one of my friends telling my moms that I should take it. And my mom is very concerned about my health. She always loves me and loves to support me. However, she is always very concerned. So I made sure once the vaccine for my age came out, I quickly got it. In June, I got my second vaccine. I took the Pfizer vaccine, so it's 2 doses. At first, I was a little bit hesitant taking it, and I was like kind of scared to take it of seeing what happened and stuff. And some of the side effects were I had a very stiff arm with both shots, a stiff arm. It was like stiff, so I couldn't move it as much. But after I got both shots and I was good, I started to think back on all the things that happened through COVID. And I started to look at all the people who have suffered, who have gone through a lot, who have lost and loved things that they still lost. And I was more proud because going back to school tomorrow, actually, I feel like I'll be able to protect my classmates more now that I'm vaccinated and I'm able to go around and actually help a little bit. However, it most likely kids my age don't understand how serious this is and that we should be very cautious. So I want to say you should really, really get the vaccine because not only is it a good thing for you, but it's a good thing for the people that surround you. If you really want those loved ones that you really love to be safe and careful, you should do the right thing and not be selfish and get it yourself.
Thank you, Taylor. Thank you. And I want to thank each one of you for coming on the broadcast. And if you notice, I have a bunch of young folks. And I did it for a reason because young people can reach younger people quicker than my generation. And that was the reason that I wanted you to come on because God has blessed each one of you. You're doing great things and we want you to continue to do great things, but we also want you to be able to influence your peers. And some of you have a platform, the microphone, and we want you to use it. You know, we want you to spread the news about that COVID is real, that COVID is not a hoax. I remember when I was in high school, I had a teacher and she would always say that ignorance is bliss. Because if you don't know, then you're in a blissful state. But God wants us to be aware, and God wants us to be aware of what's going on. He wants us to be aware of the dangers of COVID-19, not that we are going around with the spirit of fear. That's not the case, but he does want us to be aware so that we can reach back and help others. And that's what it's all about. Reaching back and helping others to become more informed. And Shana, we want to thank you for what Diversity Health Clinic is doing. And I'm sure that you all have seen a lot of suffering. Rashad, in your profession, you have seen a lot of suffering. And we want this thing to be eradicated, you know, and I want to say that we have prayed and prayed and prayed. And I feel that the answer to our prayers is the vaccination. And not only did God allow 1, but he allowed 3. We have the Johnson & Johnson, we have the Pfizer, and we have the Moderna. And I had the Moderna. And I can honestly say the first shot I had, I didn't even feel it, didn't even realize I had it. Now, the second one, I felt a little bit tired because I'd been running and so I should have been resting. So I slept maybe for about 3 hours. And after that, I was good to go. So those were the only side effects that we have had, but we've had the medical person on to let you know that you may possibly have some side effects, but the side effects are not going to kill you. The virus can kill you, and we don't want this virus to kill anyone else. So we just thank you for being on. And before we close out, I want to give each one an opportunity just to say some parting words, before we close out. And I'm going to start with Shauna.
Again, my encouraging words are to please get vaccinated. If you're in the Hinesville, Liberty County, Long County, Wayne County area, we are offering the vaccines, Moderna 2-dose, 28 days apart at Diversity Health Center, 301 Fraser Drive. You can call us to make an appointment at 912-877-2227. Not only are we offering the vaccine, we are offering COVID testing as well. So if you think you've been exposed and you need a test, you can call that same number, 912-877-2227 for testing and vaccines.
Thank you so much. Jaden.
Yes, my encouraging words are to our listeners to just protect yourselves, and hopefully we educated everyone based off of our experiences. It's been a pleasure learning from all of you today, and nice meeting everyone.
Thank you. Taylor?
My encouraging words are, do not look at the past so much or else you'll miss the future. So make sure to get the vaccine, because in the past, you might have been hesitant about COVID, and now look at you in the future. You're better than ever.
Thank you, Taylor. That's my granddaughter, y'all. You all. Okay, Jerrica.
That was a word, Taylor. I don't know what I'm gonna say after that. I guess my biggest takeaway, I hope that you guys took away from this, is do your research for yourself. You cannot go off of what everybody else says. You got to do it for yourself, and do what's best for not only yourself, but it's best for everyone around you and the people that you love, because you never want to be the carrier to give it to the person that you love and something happens. So just do your research, be informed, and let's all get vaccinated so that we can go outside. I want to go outside, y'all.
Thank you, Jerrica. And Jerrica is my niece, and I want to just share this little tidbit. When she graduated from Tuskegee, I attended, and the speaker was First Lady Michelle Obama. So I was blessed to be a part of that. Thank you, Jerrica. Keir, and Keir is my nephew.
First of all, I'm gonna say use common sense. You know, for those that have it, be wise. And stay prayed up, and let's just get this thing under control so we can get back to normal. Because I really miss getting hugs from a lot of people, and I want to do that. So that's my advice.
Thank you, Karen. I miss my hugs also, so I'm going to give you a virtual hug.
All right.
Okay, Rashad.
It's kind of hard to come behind all this wisdom and encouragement that y'all already said. However, I say to you all, use wisdom, do your research, pay attention to your body. I was been trying to do research myself, and they're saying the Delta variant is not so much of a loss of smell and cough, but more of a sore throat. Got this study from Yale. Sore throat, runny nose, fever, and headaches. So don't sleep on the small signs. Pay attention to what's going on around you, and get vaccinated. Get vaccinated. That's all I have to say.
Thank you once again.
Okay.
And Marcel had to log off, but once again, thank you for being a part of this panel, for the information you shared, for being transparent. And we pray that, I feel in my spirit that as a result of this broadcast, that more people are going to become vaccinated, because the intent was to help someone who may be on the fence, or they may not know, because sometimes people have been fed misinformation, but you all were able to share, your experiences. And we do not want anyone to get COVID, but unfortunately people are going to get it. But we will continue to pray, and we will continue to pray. And once again, I want to say thank you. I want to thank our listening audience. And this has been Let's Talk Radio. And I'm Pastor Edith Anderson of the Marygrove Missionary Baptist Church of Gardner, Georgia. And I also want to thank our sponsors, Unlimited Taxes and More, Walthauer Rental, and Albert Gaitham Ministries. And once again, we say thank you. And I just want to encourage each one of you out there. It doesn't matter what you're going through. You may have gone through COVID. You may be currently going through COVID. But I want you to know that there is nothing too hard for God and that God loves you. And I want you to be safe. Whatever you do, you've heard our guests say, be wise, use common sense, and stay safe. Stay safe. And if you're not vaccinated, please, whatever you do, get the vaccination. And with Diversity Health Clinic, they have to make an appointment, but I do want to share that you can walk in Walmart, Walgreens, or Kroger's, and you do not have an appointment. Don't worry about having an insurance. Just go and get your shot. Once again, God bless you. Thank you. And this has been Let's Talk Radio. God bless you.